UK Health Security Agency is investigating after polio was detected in sewage from North and East London. The last case of wild polio contracted in the UK was confirmed in 1984, and the UK was declared polio-free in 2003. People are being urged to ensure that their vaccines are up to date. Well, let's speak now to Professor Adam Finn, who's Head of Paediatrics at the University of Bristol and a member of the Joint Committee on Vaccination and Immunisation, or JCVI, although I think you're speaking in a personal capacity today for us. Thanks so much for talking to us. What do you make of this discovery of polio in sewage in London? Is it a cause for concern, do you think?
Yes, Anna, it is. It's something we do need to pay close attention to. This is something that's happened in other countries in the West in recent times, but not so far until now in the UK. It's not entirely surprising that this has happened, but it is something we should be paying attention to and doing our best to stamp out.
Well, yes, and could it come about because people have had a vaccine against polio and that's somehow been shed from their systems and is being picked up in sewage?
That is what's happened, although not the vaccines that we're using in the UK, because since 2004, we've been using an injected inactivated vaccine that doesn't contain any live virus. But the oral vaccine, which does contain live virus, is still widely used in other parts of the world as part of the polio eradication program. And so the virus will have been imported by someone coming from one of those countries who's received the vaccine there.
So does it mean that it could just be coming from people who are vaccinated and there's no reason to suggest that it's spread at all?
I'm afraid there is reason to suggest it's spread because this has been picked up now over a period of several months. And when we see importations that are like a one-off, if you like, somebody who's come with the recently been vaccinated, that usually just pops up for a short time and then disappears. Whereas we're seeing genetically related viruses persistently over a period of months now. And that strongly suggests that there's transmission going on between people within the UK and in this area of London in particular.
And how risky is that? Because there is a widespread vaccination programme against polio in this country, isn't there?
Yes, the risks are low because just a very large majority of people have been vaccinated adequately to protect them. But nevertheless, there are people who haven't been vaccinated at all and others that have not been fully vaccinated. And these kind of viruses can actually cause polio. Even though they come from the vaccine, they can gradually evolve back towards virulence and cause paralysis. So this is something we do need to pay attention to. And in the short term, people should check that their children have had all their scheduled vaccinations, particularly if they're in North London, but elsewhere as well, just to minimise any possible risk.
And remind us what we're talking about here with polio, because we've not had many cases of it for some time. Remind us what kind of a disease this is.
Yeah, I mean, vaccines are a victim of their own success, aren't they? We constantly forget about the diseases that used to exist that have disappeared as a result of vaccinations, and polio is a good example of that. It causes an illness with fever, a bit like flu, and most people who get it make a full recovery without any serious problems. But unfortunately, a minority of people can get this paralysis. Usually affects the legs, but it can affect other parts of the body. And in some cases, it's permanent, so that you get weakness of one or other of the limbs. People can't move normally. And then even though they recover from the infection, that can, on some cases, be a permanent problem. So it's a serious illness, one that we definitely want to avoid people getting.
No, absolutely. And are there symptoms people need to look out for if they're not vaccinated and are concerned?
Well, the general symptoms that people get are very easily muddled up with other infections, fevers, aches and pains, headaches, flu-like symptoms. But if you experience any kind of weakness so that your muscles don't seem to be working properly and you can't seem to move normally, that's a sure sign that you may have polio. There are other causes of those symptoms, but polio is a possible cause and should certainly lead people to get medical attention if they experience anything like that.
OK, but the real advice today, Professor Adam Finn, is check the vaccination status of yourself and your kids, basically.
Absolutely. Children get 3 doses as babies in the first year, another dose booster at 3, and then a final booster at the age of around about 13, 14. Make sure they've had all of those doses. If not, get in touch with your GP and get them immunised up to date.
Professor Adam Finn, thanks very much indeed. Really interesting to talk to you, and thanks for filling us in on that. We appreciate it.
Thank you.